Hi there. My name is Robyn Rowe, and I am a PhD candidate and a research associate in the School of Rural and Northern Health at Laurentian University in Canada. And this is my presentation for the International Population Data Linkage Network Conference 2020, Planting the Seeds of Indigenous Population Health Data Linkage. So I do have a paper coming out with some wonderful co-authors who I will list in a moment. And so keep an eye out for that. The paper is called The Seeds of Indigenous Population Health Data Linkage, Creating a Pathway Towards Nation Rebuilding. So I do want to begin by humbly acknowledging the traditional land and water keepers of the space that I live, which includes the Atikameksheng, Anishinaabe, and the Wahnapitae First Nation of the Robinson Huron Territory, Treaty Territory. So I don't have too much time. I would like to position myself a little bit better, but 10 minutes goes by very quick and we got a lot to get through. If you'd like to follow me on Twitter, it's Robyn K. Rowe. If you have any questions, rrowe@laurentian.ca. So before I begin, I really do need to thank my co-authors, Stephanie Russo-Carroll, Shiloh Healy, Dr. Desi Rodriguez-Lonebear, and Dr. Jennifer Walker. They have been an incredible and valuable source of information throughout this whole process. And I also do need to thank all the special acknowledgements section there on the side. I wish I had more time to actually individually give shout outs to everybody. But I really want to take a moment to pause on our elder. We had an elder who was part of some of the discussions, and his name is Elder Mike Bruised-Head. He asked that everybody learn something at the conference in 2018, which was the IPDLN Conference in 2018, where all this information is kind of stemming from, and to take that information and to share it with at least 50 people. So this is part of my contribution to fulfilling my promise to Mike. So data are increasingly accessible through digitization, and the lens that we use to collect, analyze, and use data have the power to impact decision-making, advise policy, enhance understanding, and influence resource allocation, as you all know. So in 2018, a group of Indigenous data leaders from around the world gathered at the IPDLN 2018 to share ideas around Indigenous data linkage. So this presentation presents the braided culmination of these discussions, the discussions that were had have resulted in a set of principles called the S.E.E.D.S of Indigenous data linkage. So what is Indigenous data? Just very quickly, Indigenous data includes any information in any format that affects Indigenous lives at the individual or collective levels. That can be information about our land, our resources, people, or nations. And Indigenous data sovereignty is the right of Indigenous peoples to govern the collection, application, and ownership of Indigenous data and information. Well, Indigenous data governance are the mechanisms that are set in place that help us to actually implement and activate Indigenous data sovereignty. So Indigenous population health data linkage, data are being added to as Indigenous knowledges are reproduced, renewed, revitalized, and become more reflective of Indigenous people's interests, values, and priorities. Now, in particular, the United Nations Declaration on the Rights of Indigenous Peoples marks a milestone for Indigenous peoples globally as an international human rights instrument that was adopted by the United Nations. So the UNDRIP outlines a set of minimum standards aimed at protecting Indigenous peoples around the world. In particular, of the UNDRIP, it articulates Indigenous data sovereignty principles in 9 of its 47 perhaps, 46 articles, articles 3, 4, 5, 15I, 18, 19, 23, 31, and 33. These highlight the right to self-determination, the right to autonomy, the right to self-government, the right to maintain and strengthen distinct legal, political, economic, social, and cultural institutions, the right to practice and revitalize languages, cultures, and traditions, the right to protect natural and cultural heritage, and the right to establish and control educational systems and health. So these are the rights, the inherent rights of Indigenous peoples globally. And so as we move forward, Indigenous data sovereignty really grounds itself in the UNDRIP document. So advancing Indigenous data sovereignty globally. So there are things happening all over the world. We are talking about this on a regular basis. And so really what the idea is that It's important to recognize Indigenous peoples have inherent rights to self-determination, sovereignty, and self-governance. These aren't something that are earned, they simply exist. So as we move forward, global initiatives are advancing their collective rights by instilling Indigenous-based protocols for how Indigenous data are defined, owned, accessed, and controlled. So with historic and ongoing challenges in Indigenous data environments, particularly around Indigenous health data linkage, speakers were invited to take part in a series of discussions around how successful Indigenous data linkage approaches are being implemented around the world. So this happened during the IPDLN Conference in 2018. These discussions articulated common priorities and practices that are taking shape or being enacted in Canada, which included Alberta, British Columbia, and Ontario, in New Zealand, and in the United States. We were all invited and we were asked questions on what Indigenous-led data linkage looks like and what respective regions are doing. And so from that, we compiled all the information that we gathered from a pre-conference discussion with these Indigenous global leaders and a panel discussion and a keynote address. And what emerged from that are the S.E.E.D.S principles. And so they begin with as a set of guiding principles. They begin with prioritizing Indigenous peoples' rights to self-determination, making space for Indigenous peoples to exercise sovereignty. They adhere to ethical protocols. They acknowledge and respect data stewardship and governance, and they work to support reconciliation between Indigenous peoples and settler states. So what does that all mean? In particular, we're looking at self-determination. And so this is about Indigenous priorities around Indigenous data linkage, and they highlight the inherent rights of Indigenous peoples to self-determination and autonomy. Indigenous nations, leadership, and organizations need to identify Indigenous health priorities. Indigenous nations, leadership, and organizations must also lead research and decision-making processes within research. This process works to decolonize and transform data collection methods, and data environments. It respects Indigenous people's ways of knowing, being, and doing, and in turn incorporates Indigenous knowledges and languages throughout the entire research process. Indigenous definitions of health and wellness are also prioritized as part of self-determination, and health identifiers are decided upon by the collective. And finally, through processes that decolonize data, space is made within Indigenous health research for Indigenous nations to define what Indigenous data are, how diverse Indigenous nations will be identified within data environments, and ultimately how Indigenous data will be linked to non-Indigenous data sets. Very quickly here, moving through exercise sovereignty. Enacting self-determination requires that the inherent rights of Indigenous nations to exercise sovereignty be recognized. So this includes non-Indigenous groups respecting Indigenous sovereignty while making the necessary space for Indigenous peoples to lead research and exercise that sovereignty. Indigenous data are sacred. As such, non-Indigenous data holders can contribute towards Indigenous data sovereignty priorities through capacity building, infrastructure support, and by making the space for discussions that support Indigenous frameworks around data transfer. And applying Indigenous data sovereignty principles throughout all the steps can lead to more meaningful results. Ethical considerations that adhere to Indigenous priorities must also reflect Indigenous diversity and Indigenous nations' right to privacy. Indigenous ethics value the importance of meaningful relationships, partnerships, collaborations, and relationship building. Linkage without consent impacts Indigenous lives. And so all these tenets piece together to form the E in S.E.E.D.S. Data stewardship and governance. So meaningful partnerships that seek to link Indigenous data should be collaborative in nature, respect existing Indigenous data governance principles, and highlight who makes decisions around Indigenous data. Parameters would also need to highlight Indigenous community expectations for the use of said data, who makes decisions about the data, who would have access and jurisdiction over the data, and other predetermined conditions. Throughout all research processes, it's also imperative that researchers and data holders recognize and support reconciliation with Indigenous peoples. Mobilizing this means that research processes must prioritize Indigenous nation-based research priorities that assert the rights and interests of Indigenous peoples and work towards improved social, emotional, mental, and physical aspects of whole health. So, in conclusion, the S.E.E.D.S principles emerge from and affirm the UNDRIP. They braid together international Indigenous perspectives and can guide respectful research approaches for linking Indigenous health data. Each of the 5 elements of S.E.E.D.S interweaves and needs to be enacted together in order to create Indigenous data linkage, an appropriate Indigenous data linkage environment. S.E.E.D.S should be recognized as a living and expanding set of principles. S.E.E.D.S provides a clear and concise snapshot into the collective processes and regional considerations around Indigenous health data and linkage. And when implemented together, the primary goals of S.E.E.D.S principles is to guide positive Indigenous population health data linkage in an effort to create more meaningful research approaches through improved Indigenous-based research processes. So the implementation of these principles can in turn lead to better measurements of health progress that are critical to enhancing healthcare policy and improving health and wellness outcomes for Indigenous populations. So thank you so much. And again, I do have a paper coming out in the coming months, so keep an eye on that. And Chimigwech, everybody.